All right, welcome to week 4. Week 4, we are going to be covering the chapter-specific guidelines for chapters 11 through 14. So that's chapter 6 in your Buck step-by-step book. But before we do that, we're going to go over the even number answers. Even number answers. We'll start off with chapter 5, chapter review, theory and practical in the Buck step-by-step book. And we did some of this in class already. I'm going to repeat the answers quickly for the theory 1 through 10. Number 1, true. 2 and 3 are false. 4, true. 5, 6, 7, 8 are false. 9 is A, and 10 is B, as in boy. We're on the Buck step-by-step book, the textbook, not the workbook.
Okay, so is that the...
I was like, I got it all wrong.
I was panicking.
Wait a minute.
So page 144 in the Buck step-by-step book.
144?
144 in the Buck step-by-step book.
Wow.
In your textbook.
Yeah, I didn't have it. I got it now. Oh my gosh. Chapter 5. Chapter 5. Too practical.
All set? All right, can we go on to number 11? Number 11, you should have D as in David, 5.1.0, and G as in George, 3.2.0. Number 12, D as in David, 00.01. 13, endocarditis is what you should have started to look up, and then bacterial. The code is I33.0. 14, J 44.0. 15, J 15.3. 16, E as in Edward. 17, D as in David. 18, C as in Charlie. 19, B as in boy. And 20, A as in apple.
Doreen, could you repeat number 11, please?
Eleven is D51.0 and G32.0. And you said 16? 16 is E as an echo. All right, let's move on to the workbook. Page 19. One, 2, 3, and 4 are all true. And then 5 is false. 6, 7, 8, and 9 are true. 10 is false. 11, 12, 13, 14, 15, and 16 are all true. 17 and 18 are false. 19 and 20 are true. All right, even numbers. We did some of these in class. 22, G30.0, F02.81. 24, O98.713. B20, B as in boy, B59, (26) Z11.4, 28 T as in Tom, 45.1X5A, E as in Echo, 86.0, and C as in Charlie, 25.9. (30) I11.0, I50.9. 32, I21.3, I25.10, and Z95.0. 34, T as in Tom, 80.29 XA. A 41.9. D 66. 41.9. So for 34, you should have T 80.29 XA, A 41.9, and D 66. 36. Z 51.11. Z as in zebra. 51.11. And C as in Charlie, 22.8.
Say that again, please. C.
Z as in zebra, 51.11. And C as in Charlie, 22.8.
62.8. Thank you.
.38. C as in Charlie, 77.3. C as in Charlie, 50.411. Number 40. C as in Charlie, 67.9. 42. G as in George, 56.01. 44. G as in George, 31.83. And F, 02.80. I'm sorry, 46. F as in Frank, 10.229. 48. T as in Tom, 40.5x1a. F as in Frank, 14.288. And I, 46.8. .50, F as in Frank, 14.23. 52, E as in Echo, 11.41. 54, M, 00.20. And B as in boy, 95.5. 56, H, 90.3. And G, 09.
Could you say, I'm sorry, 56 again, please?
H as in Harry, 90.3. And G as in George, 09. .58, I, 63.231. And 60 was a report. The answer for that would be C, 61. How many did they report? How did everyone do?
Z as in zebra for 60?
C as in Charlie.
Okay, 6-1.
Yes.
Thank you.
You're welcome.
Can you just repeat 32 again, please?
Yep. 32 is I to 1.3, I to 5.10, Z as in zebra, 95.0. How did everyone do with those?
Bad.
Any questions?
Oh. What was the first one of 48?
The first one on 48 was T as in Tom, 40.5x1a. So you want to just suffer in your own misery, all alone? Okay.
See?
Let's turn to page 147 in your textbook, please. I got my own ICD-10 book last week, so I did my tabbing. So we should all be on the same page tonight. So 147 in your Buck step-by-step book and page 38 in your ICD-10 book. Again, because we have guidelines in our textbook, I want you to know where to find these guidelines in your ICD-10 book. So the first chapter that we come across is chapter 11. And chapter 11 will cover the diseases of the digestive system. This will be K00 through K95. You are going to see in here K92.2 is unspecified GI hemorrhage. Now if you notice in your ICD-10 book, it says that chapters 11 is reserved for future guideline expansion. That's because they haven't come up with everything yet. So what you will find in this chapter 11 is that the categories are sequenced in a manner that follows the path of the digestive system. So from the mouth all the way down through the anus, beginning with disorders of the teeth. And if you have a hemorrhage, this is going to be reported active bleeding. If you have active bleeding, then it doesn't necessarily mean there's a hemorrhage. So for a hemorrhage to be reported, active bleeding is not necessary. But, here's your but, the documentation must support the fact that active bleeding has occurred. So someone has hemorrhaged, there's been active bleeding, they probably had it stopped, we can do an unspecified GI hemorrhage. Understand? Okay. Turn to page 431 in your ICD-10 book, and I want you to make a note right underneath K92.9. Page 431 in your ICD-10 book, right underneath K92.2, K92.2, I want you to put a note, active bleeding not necessary. So page 431, underneath K 92.2, write active bleeding not necessary. All right, so there are going to be combination codes with your hemorrhage. And that would be something like diverticulitis of the large intestine with perforation and abscess with bleeding. That would be a combination code. That combination code for such a thing would be K57.21. So take a minute and look up K57.21. K57.21 is on page 424 in your ICD-10 book. And you can circle K57.21 and just right beside it combo code.
Oh my gosh. Oh. Attention. Please repeat it.
All right, then we have chapter 12. Turn the page in your textbook. Chapter 12, page 148 in your textbook. Page 38 in your ICD-10 book. Chapter 12 is all about skin and subcutaneous tissue. These are your codes L00 through L99. These codes also report conditions of the nails, the sweat glands, the hair, and the hair follicles. Would you say that the integumentary system only includes the skin? No, it does not only include the skin. What else will you find in the integumentary system?
Excuse me, Doreen. 148 and the step-by-step is not what you're talking about.
It's diseases of the skin and subcutaneous tissue.
So what page is that?
148 in your step-by-step book.
148?
Yep.
148 in this book is chapter 6.
Right.
Okay. All right, so diseases of the skin, is that what you said?
Right.
Okay, thank you, sorry.
You're welcome. So, diseases of the skin and subcutaneous tissue end up being chapter 12 in your guidelines. And the integumentary system includes the glands, the nails, the hair, and the hair follicles. What are the two glands that are covered in the integumentary system? Those will be the sweat glands and the sebaceous glands. When we have infections, we will use additional codes before the L00 that will direct us, the coder, to report the infection with a B95 through a B97 code. So if you look at your example on page 149, it's multiple coding, but they're also talking about cellulitis of the right small finger due to Staphylococcus aureus. So you are coding the cellulitis, but then if you were to look at those, it's going to reference your main term of infection, and they're going to tell you to look up the type of infection or the type of organism to also report the infection as well as the cellulitis. So you're going to code the organism. Pressure ulcers on page 150 in your step-by-step book, pressure ulcers. How do pressure ulcers develop? Daniel, how do they develop?
Circulation is decreased by the application of pressure.
Right. The circulation is decreased to the area of the body by pressure.
Oh, the other one, yeah.
All right, so pressure ulcers are going to be graded and reported based on what? The depth of the ulcer and then stage of the ulcer. So you'll see on page 151 in your textbook, there's 4 stages. The first stage is erythema, which is redness of skin. The second stage is partial loss of skin, which is the epidermis or the dermis. Stage 3 is the full thickness loss of skin up to but not through the fascia. And you can see right there, stage 3 in your textbook, it looks pretty sore. And then stage 4 is full thickness loss, extensive destruction and necrosis. So pretty bare, right? Page 152, diseases of the musculoskeletal system and connective tissue, which happens to be chapter 13 of your guidelines. Chapter 13 of your guidelines, page 39 in your ICD-10 book. All right, it just so happens that your musculoskeletal chapter starts with M00 and ends with M99. Most of your codes within musculoskeletal, you will have the site. So what is the location on the body? You will have the laterality. Is it right? Is it left? Is it unilateral or is it bilateral? Some of your codes will include the multiple sites, such as polyosteoarthritis, including multiple sites, which is M15. Your infectious arthropathies. These are your codes M00 through M02. You have either a direct infection or you have an indirect infection. The direct infection invades the synovial tissue, it invades the joint, and it's an invasive organism that has been identified. Your indirect infections are reactive or post-infective. The reactive, you will have microbial infection identified, but not in a joint. In your post-infective, you'll see that the microbial agent, antigen, is present, but not constant, so that there's no evidence of multiplication. And if you look on page 154 and 155 in your textbook, it gives you two really good examples on direct infection from a known organism, and then direct infection of the joint due to infectious or parasitic disease, as well as an indirect infection from an unknown organism. Coding your pathological fractures. Coding your pathological fractures. These are also known as spontaneous fracture. The fracture is reported in addition to underlying condition that is responsible for the fracture. You will never assign a code for a traumatic fracture and a pathological fracture of the same bone. And you will have a seventh character that indicates treatment plans, such as A for initial. So you heard me talk about these early on in the class. A for initial encounter is assigned as long as the patient is receiving active treatment for the fracture. D would be subsequent. This is assigned when all of the active treatment is completed. G, K, and P are assigned for subsequent non-routine encounters, and S is assigned for a sequela. What is a sequela, Shauna?
Later on after the fact.
Yes, later on after the fact, also known as late effect. Then we have osteoporosis at the bottom of page 156 in your textbook. And over on page 40 in your ICD-10 book, osteoporosis. Your osteoporosis codes, M80 and M81. This is a systemic condition that affects the bones. This is where fracture is sustained with trauma that would not usually cause a fracture. So the bones are frail, brittle. The site for these coding is not a component of codes. Category M80 is osteoporosis with current pathological fracture. This is where age and other osteoporosis codes show up. And then category M81 is osteoporosis without current pathological fracture. So let's take a moment to go to your ICD-10 book and look at those two codes, M80 and M81. So M80 starts on page 530 in your ICD-10 book. And it tells you right there, osteoporosis with current pathological fracture. M81 is over on page 531 at the bottom of the right-hand column, and this is for osteoporosis without current pathological fracture. And you'll see underneath M81, it tells you to use the additional code to identify either the major osseous defect, personal history of, healed osteoporosis fracture if applicable. So you'll notice with these codes, it's age related. Age related. And you'll notice as you go down through the codes, you'll see right, left, and unspecified. All right, and then you'll notice on page 158 in your textbook, we have diseases of the genitourinary system. This chapter reports the diagnosis of the male and female genitalia, breast, and urinary system. One of your most common disorders reported here will be kidney stones that are located under the main term of, what's a kidney stone also known as? Calculus. Okay, so turn to page 1116 in your ICD-10 book. 1116 in your ICD-10 book. I want you to find the word calculus. And beside it, I want you to write kidney stones. All right, any questions in chapter 6? Everyone read it, right? All right, let's do the theory and practical. Page 159 in your step-by-step book. In order to code a gastrointestinal condition with hemorrhage, active bleeding must be present. Shana. That is correct. It is false. Number 2. Which of the following is not included in the blocks of the digestive system? Hernia, liver, pancreas, or kidney? Daniel. Actually, it is D, kidney. Which of the following is not included in the blocks of the digestive system? D, kidney. Number 3, Darcy. A pathological fracture occurs in a bone that is weakened by disease.
True.
That is correct. True. Which of the following is not included in the blocks of the diseases of the skin and subcutaneous tissue? Spondylopathies, eczema, erythema, or bullous disorders? What do you think, Fran?
This is like the skin.
D.
Actually, it is A.
A.
All right, why don't you all take a moment and do 5 through 8.
That's for the following pressure. Let's just stages to the correct description of the stage. Stage 1. Yeah. Stage 2.
All right, everyone finished?
Yep.
All right, number 5. What do you have, Maria?
B.
Yes. Number 6, Shana. D is 6. 7, Anita.
Good.
Yeah.
A.
Yes.
Okay.
Yeah.
And Darcy, 8.
C.
Yes. So 5B, 6D, 7A, 8C. Daniel, what do you have for 9?
True.
9 is true. 10, Shana.
True.
Yes. So 9 and 10 are true. All right. Shana, I'm going to have you do 11 on the next page, 160. Daniel, number 12. Maria, 13. 14, Darcy. 15, Fran. 16, Anita. We'll take a minute and do those, and I'll come around to each of you. All right, is everyone ready?
Mine dry eyes.
Yeah, I should try.
All right, Shanna, what do you have for 11? And when you tell me, I want you to tell me how you got the answer.
I have K50.911.
Okay?
How I got the answer, I looked at Crohn's that took me to enteritis.
Okay. So for 11, Shanna got K50.911. That is correct. She looked up Crohn's disease, which in turn brought her to enteritis. So what you might want to do is make a note next to Crohn's disease. Well, it says C enteritis, right? So then under enteritis, does it have Crohn's disease?
That's where I just confused myself when I checked my answer. think how I found that was I had to look up what Crohn's was or enteritis was and then
Okay.
go by that.
Okay. So you could have found it either way. Crohn's disease, enteritis, and then with rectal bleeding, so with complication, that type of stuff. All right, so 11 is K50.911.
K.
All right. K as in kite, 50.911. All right, Daniel, number 12.
Well, I got K44.1, and I got that by looking up hernia, and then from hernia it
Probably took you to diaphragm.
from there it took me to the specifics, and I just had to go to diaphragm, and then I added the gangrene.
Okay, so number 12 is K44.1. He started with hernia, then diaphragm, and then with gangrene. All right, who had 13?
Me.
All right, Maria, what'd you get?
Okay, I actually have two. The first one, M24.41,
Okay,
and the other one, I have S43.006.
okay. You only needed one code, and in the book, it will tell you if you need more than one code. It will say code and then S in parentheses, or it will have two spaces if it's supposed to have two codes. So that'll be something to look for from here forward. If it says code or codes with parentheses, S in parentheses, or two spaces for codes. So you only needed one code for this. And so how did you start looking it up?
I went under shoulder first, and it directed me to go to the actual problem, which
Okay.
was dislocation. So
Okay.
I found it under. I found it one on. I found one on the shoulder, and then I found the other one under dislocation.
Okay, so you can do it either way. You could have started with dislocation, recurrent shoulder, or you could have gone to shoulder and it would have directed you to dislocation. But the answer for 13 is M24.411. You needed that additional one to indicate right or left.
Okay, thank you.
Yep. Number 14. Who had 14?
I did.
Okay, how did you do that one, Darcy?
I looked up dermatitis
Yep.
and then due to plant, except food, and then
Okay.
it was L23.7.
Good. Yep. Good job.
Say
All
that
right.
again, please.
L23.7.
L23.7. Thank you.
Yep. All right, 15. Who had 15?
I did.
All right, Fran.
All right, so paronychia of the toe, I had L03.039.
And how did you look that one up?
I went right to paronychia, and it told me to go to cellulitis digit, which I did, and then I found it under toe.
Very good. All right, and 16, Anita.
K60.3.
All right, and how did you look that one up?
It's like fistula and then anal.
Very good. All right, so 17 is lower gastrointestinal bleeding due to angiodysplasia of colon. Where would I start with that one? Anybody?
Colon.
Actually, it says due to. Due to what? Angiodysplasia. So the answer for that is K55.21.
Okay.
Number 18, diverticulum of appendix. What am I going to start with on that one?
Appendix.
Yes, diverticulum. K38.2. Number 19, acute and chronic cholecystitis with cholelithiasis. So this is one of those combination codes. Where am I going to start with this?
Cholecystitis.
Okay. And
Cholecystitis. And
what did you get for a code?
We didn't do that. I didn't do that.
That's fine. K80.12.
Okay, 80.12.
Number 20, Mr. Jones presents to the emergency department with acute abdominal pain. After a thorough exam and diagnostic x-ray film, Mr. Jones is diagnosed with acute small bowel obstruction and taken immediately to surgery. What's the reason for the encounter here?
Acute abdominal pain.
And what's that from?
Obstruction.
Obstruction. So where would you start?
Obstruction.
Obstruction of the intestine. Very good. So the answer for this would be K56.60. K56.60.
Could somebody repeat 15 and 16, please?
15, L03.039.
03.39.
16, K60.3.
K60.3. Thank you.
You're welcome. All right. This was actually a short chapter. So we're going to actually go on to chapter 7. I know I didn't have you read it, but I'm going to review it, and you can take some notes if you want to in your book. And that way when you go home, maybe it will be fresh in your mind when you read it. How's that sound? Otherwise, I mean, it makes it easier to combine a couple chapters than it does to leave early and go start another chapter. How's that sound? I'd rather get as much done as we can. So actually, if we do that, this kind of takes off a week. So that's good. So let's turn to chapter 7 in our textbook, page 161. You look lost, Shauna. Okay. All right, 161 in the textbook is chapter 7. And these are ICD-10 specific guidelines for chapters 15 through 21 in your ICD-10 guidelines. So if you actually turn to page 41 in your ICD-10 guidelines, and I'm still having a hard time saying ICD-10. I'm so used to using 9 that it's going to take a while, so bear with me. Chapter 15 in the guidelines starts on the bottom of page 40 and rolls over onto page 41 in your ICD-10 guidelines. Now, our guidelines for chapter 7 in our textbook start right out with pregnancy. Pregnancy, childbirth, and these are your O codes, O00 through O9A. And what you will find here is that any condition that occurs during pregnancy, unless the physician documents it, neither affects the pregnancy or is affected by the pregnancy. Your Chapter 15 codes are never used on the record of the newborn. So Chapter 15 codes are never used on the record of the newborn. So you might want to highlight on page 41 in your guideline book It says Chapter 15 codes used only on the maternal record. Number 2, Chapter 15 codes used only on the maternal record on page 41 in your ICD-10 book. Highlight number 2. Now, the other thing that's nice about your ICD-10 book that I noticed this time around is that you actually have guidelines right before each chapter within the book. Not only do you have guidelines in the front of the book, where your guidelines are for coding and reporting, but right before each chapter, there's a few pages that talk about the guidelines that are specific to that chapter. So when you are looking up your codes, it wouldn't hurt to take a moment to read through those few pages before each section and maybe or make sure that when you've tabbed your book that those are your tabbed first pages. You don't have to specifically say, guidelines. You can just simply put the 00 through 09A, and then when you go to that tab, there's all your guidelines. You'll notice too, if you turn to page 583 in your ICD-10 book,
It's
583 in your ICD-10 book. If you look at the top left-hand column, page 583 in your ICD-10 book, top left-hand column, you have another note right there. It says, codes from this chapter are for use only on the maternal record, never on the newborn record. Page 583 in your ICD-10 book, top left-hand column. Note, codes from this chapter are for the use on maternal records, never on newborn records. It also tells you how trimesters are counted. It tells you what defines the trimesters. And it tells you to use an additional code for weeks of gestation. Those are things you want to highlight so they stick out at you. And keep in mind that when you're coding pregnancy and childbirth, you might have to query the physician. There is sequencing priority. Chapter 15 codes have sequencing priority over codes from other chapters. Your Z33.1 is incidental pregnancy state. This is reported if a physician documents an incidental status. Your code 15, your chapter 15 codes, again, are only for the mother's record, never on the newborn's record. Your routine prenatal visits, your routine outpatient prenatal visits with no complications fall under the Z34 category code. These are your first listed codes. Your routine high-risk prenatal visits are the 009 category codes. These would be first listed codes. Your outcome of delivery. These are the Z37 codes. Over on page 164 in your textbook. Up at the top of the page, outcome of delivery, Z37 category code. This is only reported once. And where is it reported, Daniel? Yes, only on the mother's record. Your trimester and time periods. Trimester and time periods. The majority of codes, the final character will indicate the trimester. Your trimester is calculated from what, Shauna? The LMP. What's the LMP? The last menstrual period. So the first trimester is less than 14 weeks in 0 days. Your second trimester is 14 weeks, 0 days to less than 28 weeks, 0 days. And your third trimester is 28 weeks, 0 days until delivery. What would be the peripartum period, Darcy? The peripartum period. The peripartum period is on page 166 in your textbook. The peripartum period is the last month of pregnancy to 5 months of postpartum. And your postpartum is immediately after delivery to 6 weeks after delivery. So peripartum, last month of pregnancy to 5 months postpartum. Postpartum, immediately after delivery to 6 weeks after delivery. An ectopic pregnancy. Ectopic pregnancy. This is where the fertilized ovum implants outside the uterus, over on page 167 in your textbook. An ectopic pregnancy, fertilized ovum implants outside the uterus. We would report this with an O00 code based on the location of the pregnancy, such as an ovarian or a tubal. If there are complications associated with the ectopic pregnancy, we would report code O08. O08 are for complications. What is a hydatidiform mole, Shana? Hydatidiform mole. It is, yes, a tumor of the placenta. It secretes hormones. And you would report this with category O01. Any complications with this, use category O08. If there is a malignancy, report D39.2. If there is a malignancy, report D39.2. Hypertension in pregnancy. Turn to page 168. Hypertension. If there is pre-existing hypertension that complicates the pregnancy, delivery, or the 5-month period after birth, you're going to use category 010, and this would be one of those first listed diagnosis codes. Fetal conditions on page 169. Your fetal conditions fall under category 035 and 036. These report fetal abnormalities that affect the care of the mother. If fetal abnormality does not affect care of the mother, do not report 035 or 036. Turn the page to 170 in your textbook. Diabetes mellitus in pregnancy. Type 1. What is type 1, Fran?
It's the type of diabetes that requires insulin because you don't make any.
Right. Type 1 is where little or no insulin is produced, so you have to control it with insulin, and we would actually report the use of long-term insulin or long-term use of insulin. Type 2. What is type 2, Darcy?
Your body produces too little insulin.
Right. Too little, or the body cannot use the insulin that is produced, so we control it with diet, medications, and or insulin, and we may report the long-term use of insulin. What is gestational diabetes? Daniel.
It's type of diabetes that develops in the second or third trimester of pregnancy. Not have either type of diabetes.
Right. It develops in the second or third trimester in a patient who did not have diabetes prior to pregnancy. There are certain conditions originating in the perinatal period. This is chapter 16 in your guidelines. It falls under P00 through P96. Page 46 in your guidelines of ICD-10 book. Certain conditions originating in the perinatal period. Again, page 46 in the ICD-10 guidelines. Chapter 16 codes are only on the newborn's records. So chapter 15 codes were for the mom. Chapter 16 codes are for the newborn. Category Z38 reports a live born according to place of birth and type of delivery. This would be a first listed code. It does not report congenital malformation, deformities, or abnormalities. Rather, if those were in play, you would code using Q00 through Q99. Turn to page 172 in your textbook. All right, now congenital malformations, deformation, and chromosomal abnormalities. are Chapter 17 in your guidelines. You'll notice it's on the bottom of page 172 and runs over to page 173 in your textbook. The codes that this category falls between are Q00 through Q99. Any anomaly is an abnormality of a structure or organ. Congenital refers to an abnormality with which a person is born. The term perinatal applies only to the baby, and postpartum applies only to the mother. Keep that in mind. Perinatal applies only to the baby. Postpartum applies only to the mother. The Q codes may be first listed or secondary diagnosis. You would sequence secondary diagnosis with the category Z38 code in the initial birth record. It would be reported whenever a condition is diagnosed. Again, if it's congenital, it's what, Daniel? They're born with it. Congenital is they are born with it. And a physician must document an abnormality. All right, turn to page 175 in your textbook. Symptoms, signs, abnormal clinical and laboratory findings. The guidelines are on page 48 in your ICD-10 book. What is a sign, Shana? Go ahead, Maria. 48 in your ICD-10 book is the guideline for Chapter 18. All right. Signs and symptom codes are used for encounters until a definitive diagnosis can be made. We learned that early on in the class, correct?
This is what you use if you don't have any diagnosis.
Right. We use these in place of those until we get a definitive diagnosis. So no specific diagnosis can be made until further investigation. Your signs and symptoms reported as existing at the time of the initial encounter, they need to be proven so that we can determine what is the actual cause. If a patient for some reason fails to return or is referred elsewhere, and all of the coder has is a provisional diagnosis, then that is what you would use. You need to have a more precise diagnosis as much as possible. There are certain symptoms that represent important problems in medical care, and it might be that you need to classify them in addition to the known cause once we have that information. So if we have a sign, this is objective evidence of a disease. If we have a symptom is a subjective observation. So you report symptoms only when there is no more definitive diagnosis available. So, Shana, a patient complains of pain in the right lower quadrant. Diagnosis states acute appendicitis. Am I going to report the symptom of pain? Correct. I will not report the symptom of pain. So chapter 18 is pretty straightforward. Everyone gets that one? All right, let's move on to page 179 in the textbook. Injury, poisoning, and certain other consequences of external causes. Chapter 19 in the guidelines starts on page 49 in your ICD-10 book. In the textbook, we're on page 179. Your injury and poisoning codes start at S00 and go through T88. With your injury and poisoning codes, you will have A, D, and S. A stands for what, Fran?
Initial encounter.
Initial encounter, yes. And what does the D stand for? Bless you, Darcy. On the bottom of page 180, D is for
Subsequent.
subsequent encounter, and S is for sequela. So A, being initial encounter, is receiving active treatment for the injury. D, subsequent encounter, we've completed active treatment and they're receiving routine care during healing. And S, sequela, is a direct result of injury, so you add the S to the injury code, not to the sequela code. Turn the page to 182 in your textbook, coding fractures. Coding fractures, traumatic fractures. If the fracture is not indicated as open or closed, how are we going to report it? We are going to report it as closed. If it is displaced or not displaced, we're going to report it as displaced. To assign the seventh character, we've already talked about some of these. A, initial encounter for the closed fracture. B, for the initial encounter. Now, if you look on page 184 in your textbook, it gives you a box, the seventh characters of category S72. And it lists right in there the seventh character. Those are all the seventh characters that might be used for a fracture. All right, take a moment and turn to page 798 in your ICD-10 book. (798) in your ICD-10 book. And you'll see in the right-hand column, right in the middle there, it gives you the appropriate seventh character to be added to all codes for category S72. You want to highlight the top line and put a bracket around it. Okay? Now, I know that early on in the class I talked to you about reading the before, the middle, and the end. So let's just say, for instance, our diagnosis for this was S72.046. Just hypothetically out there, okay? S72.046. Well, if you've never coded in S72 before, what are you going to do?
Just going to code S72.0.6.
Okay, but you need to understand what an S72 category is. So in order to do that, you go all the way back to the beginning and you find S72. And all of your, what do you want to call them, main categories are in red. Why are they in red?
Because you
Right.
have to code further for more
Right,
specifics.
you have to code further. So when you see those main categories in red, I want you to read the notes that are attached to that category, because the notes that are attached to the main category follow through to all the codes within that category. And you're not going to find this 7th character to be added to all codes from this category on any other page within this section until you probably get to another category. Does that make sense to everybody? So if you look on page 798, right-hand column, it gives you all the 7th characters that may be added to those codes in that category. So you keep going, you look through, okay? I'm looking over on page 801 is where I see a 7th character to be added to all codes in S72.47. Okay, so any code falling under S72, you may have a 7th character, A through S, that might apply to any code under S72. When you reach S72.47, your 7th character might change to an A, D, G, K, P, or S. You have to pay attention to your sections, your headings, your subheadings, your categories, your subcategories. Does that make sense, Fran?
Yes.
Anita?
Yes, it does.
Yeah.
Darcy?
Yes.
Maria?
Yes.
Okay. It was much easier in the ICD-9 book, honestly. So,
I get all the way
It's
up
red,
to,
look for a definition.
yes, look for a definition. Go ahead, Shanna.
I get all the way up to here, but then I don't get to.
Okay. So, what basically happened is we started at 72, and we saw that we could have 7th character additional character, right? Anything from A through S. So you're going to, as you code anything up to S72.47, from here to here, you might add any one of these 7th characters. When you get to S72.47, your 7 characters change. Your 7th character now would fall from here until you find it again as you move through the book. So now it changes here again. So anything from S7247 to S72.92 would have a 7th character added.
Oh, so we should highlight
Yes.
the letters.
Yes. Yep. Yep. And then when you get to S73, you now have 7th character of A, D, or S. Is that better?
Yeah.
Okay. So
That's what I thought.
you have to really pay attention to the categories, to the codes. What is your information at the very beginning? That I can't stress enough how important that will be to look at your category start places and see and read through, okay, everything looks fine. Oh, here I am, S7247, my 7th characters have changed. Okay, over on page 802, oh, I'm under S73, my 7th character has changed again. You have to pay attention. Now, mind you, it tells you right next to it that it needs a 7 character, right? You have a circle with a 7. But let's just say, for instance, okay, S73.003 tells me I need a 7th character. What if I didn't see up above that I was choosing from A, D, and S, and I went all the way back to page 798, and I chose one of those 7th characters? See what I mean? Pay attention to where you are in your categories.
But if you did do that and you coded it that way, it would just get kicked back to you?
Yes. If you code it incorrectly on a claim, yes, it will get bounced back to you. Or they might just overlook it and pay you. And then come back later on and say, oops, we paid you incorrectly. Send us notes. Then you have to appeal it. Oh, whatever. Okay? But just really pay attention to your categories. All right, talking about your traumatic fractures still. If you have multiple fractures, you want to sequence them according to the severity. If you have a dislocation and a fracture of the same bone, what are we going to report, Daniel? If we have a dislocation and a fracture of the same bone, what are we going to report?
Fracture.
Yes, because it is more severe.
Oh, that's kind of odd, honestly. I honestly think that you would report. I can understand reporting the fracture first, but you think that you would report both.
No, because actually the fracture is the more severe.
Well, I understand
Yeah.
that it's more severe, but you know what I'm saying.
I do.
It seems like with all the specificity that we've gone through so far.
Yeah, it ends up being one of those combination type codes. You assume, and I should, we should never assume, because what happens when you assume? But we assume that with a fracture, there's some form of dislocation as well. Category M80 reports your non-traumatic fracture for patients with osteoporosis, even if the injury is by trauma, because we're seeing that the patient has osteoporosis, and we know that pathological fractures occur due to that disease and weakness. Burns and corrosions on page 184 in your textbook. Burns and corrosions. Thermal burns are from a heat source, except for a sunburn. Corrosion burns are due to chemicals. There are some guidelines for burns and corrosions. Your burns are classified by the depth. So the first one would be the erythema. The second would be blistering. And the third would be the full thickness. So what do we sequence first? We sequence the highest degree burn first. If we have multiple burns in the same area, we report only the highest degree burn. An infected burn, use additional code for infection. Late effect of burns, we would report with burn or corrosion code plus the 7th character S. Adverse effects, poisoning, underdosing, and toxic effects. We use the T codes, T36 through T65. We have combination codes that include the substance and the external cause. We sequence these codes first, and then we follow the code that specifies the nature. Again, you are not going to code directly from your drug and chemical table. You're going to look up the code, and then you're going to confirm it in the tabular. Your poisoning. What does poisoning include? Over on page 189. What does poisoning include? 189 and 190 in your textbook. 189 and 190. What does poisoning include? It could be an error in your drug prescription. It could be an intentional overdose. Yep, combination of drugs taken, interaction of drugs and alcohol. So your poisoning codes are T36 through T50. You would report any associated intent, such as accidental, intentional. You would report all manifestations of poisoning, such as vomiting. All right, so let's turn to page 1487 in your ICD-10 book. So you should have a tab on this, drugs and chemicals. Table of drugs and chemicals. Page 1487 in your ICD-10 book. So what I like about the heading here is they've done it for you. Poisoning, accidental, unintentional. If you look at the headings at the top of the page. Poisoning, intentional, self-harm. Poisoning, assault. Poisoning, undetermined. Adverse effect, underdosing. What is an adverse effect? It occurs when drug is taken correctly, the patient has a negative response. So you might want to write next there, right underneath there, negative response. Patient has negative response. All right. Turn the page to 192 in your textbook. Abuse, neglect, or maltreatment. You would sequence first T74 or T76. Your medical documentation would state abuse or neglect and you would code it as confirmed. If it is suspected, you would code it as suspected. Your confirmed cases of abuse or neglect, you would report an assault code X92 through Y08. This would indicate the cause of the physical injury. And then you also would report a perpetrator code, which is Y07. When suspected abuse, neglect, or maltreatment is ruled out, we would report Z04.71 for an adult and Z04.72 for a child. External causes of morbidity. This is chapter 20 in your ICD-10 guidelines. Page 55 in your ICD-10 guidelines. External causes of morbidity. This is also factors influencing health status and contact with health services. Your I-10 guideline information for chapters 20 and 21. Okay, you'll notice that these guidelines we actually went over back in chapter 3 on page 55 and 56 because they were your Z codes. But you also have them in your guidelines, the external causes of morbidity. They should never be sequenced as first listed or principal diagnosis. Again, if you have any questions, always query the provider. Your external cause code should never be a primary code. So your Z codes are now where you enter for health services, but you might not necessarily see a provider. So chemotherapy. So if you look on page 1017 in your ICD-10 book, page 1017 in your ICD-10 book, you have your guidelines right here for multiple coding for a single condition, your combination code, your sequela and your late effects. We talked about that. You use your Z codes in a healthcare setting. As I mentioned, someone who's having a vaccination, someone who is having a exam for surgery, someone who's on long-term drug therapy, if they're doing some blood typing. Any type of encounter for screening for neoplasms, any type of counseling, encounter for routine health care for child. These are some of your Z codes. So not only will you find the information in your guidelines earlier in the book, but you will also find more information here in your tabular, in your ICD-10 book. On page 1017 is where it starts. And you'll see on page 1018, it goes through the category of Z codes. So contact and exposure, inoculations and vaccinations, status, history of. So you're going to have history of codes over on page 1020. History of, that's a big one. Your screening codes, observation codes, aftercare codes. When you hear that terminology, observation, aftercare, screening, history of, these, keep in the back of your mind, these are your Z codes. Okay, these are your Z codes. Follow-up, donor, counseling, routine and administration exam. So those are the words, those are the terminology you want to be aware of when you have Z codes. And you'll notice on page 57 in your textbook, we did go over that in chapter 3. So this is like a refresher for you. Over on page 195, complications. 195 in your textbook, complications. When a patient is admitted for a complication that resulted from medical care or a surgical procedure, the complication will be listed first. Page 195 in your textbook. If there is a complication, the complication gets listed first. Pain due to medical services. If there is pain associated with devices, implants, or grafts that are left in a surgical site, this is assigned the appropriate code found in Chapter 19.
I remember this one case of a doctor that accidentally left his hat inside of the patient after severe surgery.
How did he leave his hat in the
I
patient?
don't know. All I remember is the stories. They found a hat inside of him. He was complaining about pain with his X-ray. They found a hat inside.
Like an actual hat or his surgical cap?
Surgical cap. I'm sorry.
Okay.
Yeah.
Because that would be kind of difficult. They're not supposed to have
Surgical cap,
hats.
I'm sorry.
Okay.
Yeah, that was true.
Okay. Yeah, that would be weird. All right, any transplant complications fall under category T86. Your kidney transplant complications, also T86. Any complication codes that include the external cause over on page 196, you would, as with your certainty codes, also have the external cause code included. And then for transplants, if a transplanted organ is rejected or there are complications due to the transplanted organ, the function of the transplanted organ is affected, report a code from category T86. And the report must show the complication that resulted. All right. Any questions on these two chapters? All right. We can go over answers in the workbook for chapter 6, was it? No, it was chapter 5, right? Chapter 5? Okay. Why don't we take a quick 5 minutes and we'll come back and do answers. Is everyone back? Okay, I said workbook, right? Chapter 6. Okay, before we go on, let's talk about dates, because I think, let's take a look here. For class, Thanksgiving is on the 26th, which is a Thursday. So really, we're going to be here next week, and we'll have the 26th off. And then we're going to have the 24th off and the 31st off. So we're going to have, we'll be here next week, we'll have a week off, come back for 3 weeks, have 2 weeks off, and then I've got to find out when February and, what is it, April? February and April vacation. So we started October, November, December, January, February. So we should be done by mid-March. Now, the other thing is, if the school has a snow day, and it happens to be the same day we have class, we don't have class. They will list the adult eds and say no class. As soon as I know, I usually send out an email, so check your emails. If you know it's a snow day or we're having a bad storm, please check your emails. And you all have my phone number. I do get text messages, so if you want to text me real quick and say, hey, do we have class? But check your emails first, please. All right, let's go ahead with chapter 6. Number 1 is true. We're in the workbook on page 27. Workbook, page 27. One is true, 2 is false, 3 is true, 4 true, 5 false, 6 true, 7 false, 8 true, 9 true, 10 true. $11. K03.2. And actually you have the odd numbers in the back, so I'm going to do even numbers. 12, K11.3. 14, N for 1.1, R3 1.9.
Slow down, slow down. Could you repeat that again?
14 is N as in Nancy, 4 1.1, and R as in Romeo, 3 1.9.
Okay, that was 14.
$16, M as in Mary, 25.631. M as in Mary, 25.631.
631. Okay.
K as in kite. 12.2. K 12.2. 20. 20 is M. 24.274. 22 M 53.3. 24 L 91.0. 26 K 11.22. 28 M 86.131. 30 N as in Nancy 18.6 with Z as in zebra 99.2.
What's the first part of number 30, please?
N 18.6.
And 1, 8. Thank you.
32 L 21.0. 34 N as in Nancy 93.9. 36 M as in Mary 00.031. And B as in boy 95.61.
I'm sorry, you need to repeat those two.
M as in Mary
And
00.031. B as in boy 95.61.
Okay. Thank you.
38. 38 N as in Nancy 80.1. N 80.2. Number 40. K 35.2. Number 40, K 35.2. Bless you. Number 42, N as in Nancy 75.0. On the reports, number 44, N as in Nancy, 20.0. How did you do, Shauna? How'd you do, Daniel? How'd you do, Maria?
Number 38, please.
Okay.
I have N 0.1. Doesn't sound
No.
right.
N80.1.
N 80.1. Okay. And
N80.2. You have two codes there.
N 80 N 80. 80.1. And N, the second one was N 0.6.
No, N80.2.
N 80.2. Okay, thank you.
You're welcome. All right, let's take a look at Chapter 7 workbook homework. Chapter 7 workbook homework. Again, all the even numbers, and then you have some reports. So, page 39 in your workbook, number 60, report 94. Report 94 is on page 262 in the back of your workbook. All right, Fran, take a look at that. Tell me what you would code. Everyone read it, please.
You said 94?
It's report 94, and report 94 is on page 262 in the back of your workbook.
Hold on.
No problem. Right.
I would say dyspnea with exertion.
Dyspnea.
As far as
Yep.
dyspnea, yep.
Yep. Dyspnea.
Okay.
That's all you're coding.
Okay.
That's it.
That's it. All right.
You're going to find that in the reports there's a lot of fluff.
Yep.
Now, we do need some of the fluff, but you need to figure out right away what you're coding. So it was clear right in the very beginning. Entrance diagnosis, dyspnea. Okay. I'm trying to look at what else here.
I don't have the right page.
All right, how about page 36 in your workbook? Let's go through the exercises and pick out the main terms of where we're going to start. So page 36 in your workbook. All right, Shauna, on number 26, where would you start for looking up the code? Yes, abortion. All right. Number 28, Daniel. That's pretty obvious, right?
Yeah.
So hepatomegaly. Number 30, all right, failure to gain weight, child. Anita. I just want to
Good.
know what's the main term that you would start looking up the diagnosis.
Weight.
Yep, you can do weight or failure,
Okay.
either one, okay? Number 32, initial encounter of a patient transported to emergency department. Patient died from cardiac arrest due to an accidental overdose from heroin abuse. All right, well, it was an accidental overdose. Where are we going to start looking?
What?
Darcy?
I would look at the cardiac arrest.
Okay. Well, cardiac arrest is going to be one of those codes because we have 3 boxes here. But the patient died from cardiac arrest due to an accidental overdose. So we're going to start right in our table of drugs and chemicals underneath heroin poisoning. And it was unintentional. And then we would do abuse of a drug, of the opioid. And then the third one is that arrest, the cardiac arrest. Does that make sense to everybody?
Yep.
Yep.
Okay. The second one is the abuse of the drug. Well, abuse. Yep, so you've got the overdose, so the poisoning. The second one is the abuse, and the third one is the cardiac arrest. 34, Fran.
I would say syndrome,
What kind of syndrome?
crush,
So, crush.
crush syndrome.
Yep. All right, 36, Shana. 36, cellulitis. 38, Daniel. If we have an absence of something, we have
It's not there.
Obstruction.
I don't know.
we have an abnormality. If we have an absence of sound, it's not normal, so we have abnormal. Abnormal what? Abnormal bowel sounds. Make sense?
So you look up abnormal.
Abnormal.
Could you find it under vowel?
Can try. You can try these different ways. I'm not saying that my way is always the right way. You've got to try it. What I call going in the back door. Sometimes you can, sometimes you can't. All right, 40. Number 40, newborn with obstructive sleep apnea. Anita.
Apnea.
That's going to be part of it. Who has the apnea?
Oh, okay. Oh, newborn.
Yes.
First newborn, then sleep apnea, then obstructive.
Yep. All right, 42, Maria.
Special traumatic amputation of the left index finger initial encounter. Amputation,
Yes, amputation.
and then, well, that's all. Finger,
Traumatic, and then finger. All right, 44, Daniel.
Overdose,
Yep, unintentional poisoning, overdose. Yep, try that. 46, Shana.
Cesarean.
Actually, just infant. I mean, you can try cesarean first, and then you can try infant, but it's infant, live born, and then how were they born by cesarean. 48, Fran.
Let's see, infant, premature, anemia.
You can try that, or you can go straight to anemia.
Okay.
Okay, 50, Daniel.
Death unexplained.
Yep, death. 52, Anita.
Nausea. I think vomiting and nausea.
Yep, it's nausea with vomiting.
Vomiting.
All right, 54, Maria.
Gastritis.
You actually have two codes here. The first one that you want to look up is the adverse effect because of the omeprazole. And then you want to do the gastritis with acute bleeding. Remember, I told you earlier you might have two lines to indicate two codes, or you might have the word code with an S in parentheses that says you might have two codes. 56.
So even though they don't give you the two lines there?
That's right. Daniel, 56.
I'm gonna start with what's it called, blood and stools.
Blood. Yep, blood.
And I assumed that blood would take me to the rest of it.
Yep, blood. And then what is it in? Stools. What's another word for stools? Feces. And then what kind? Occult. All right, 58. Darcy.
Pain.
Pain.
Right, pain. What kind of pain? Vaginal pain. Okay. Does that help?
Yes.
All right, let's review assignments for next week, please. So, we did an additional chapter tonight, as you noticed, but chapter 7 really was not all that long for reading. So, finish the end of chapter homework for chapter 7. Do chapter 7 workbook, even numbers. And then for next week, we have chapters 13 and 14. And I want you to bring your HickPick book, please. You should all have a HickPick book. Do you all have a HickPick book?
No.
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 That's the one I brought the first one was last year, right?
Okay, so it's that's how it's spelled. HCPCS. That's the book that you should have. If you do not have it, send me an email. Try to do it by tomorrow, please, so I can email Amy and let her know we don't have them.
I thought those were the ones that they said they weren't sending until September.
I don't know.
Yeah. We have CPT,
Right.
but no HickPicks yet.
Okay. So you need to bring your CPT, at least bring your CPT. Chapter 13 is going to be about CPT and HickPicks. And chapter 14 is going to be about modifiers. So we definitely need our CPT book. Read the chapters, do the in-chapter exercises, and try to get the end of chapter review and practical done.
For 7, 13, and 14.
Yes.
13 and 14, we just read.
7, 13, and 14, read,
Read.
do the end of chapter exercises, and even numbers in the workbook. Do as much as you can.
Can I have Evolve username and password? I don't have it right now. Username and password.
I didn't cancel it from last time, so you should still have it.
Oh,
But
see.
I will make a note to check it.
Okay, sure, thank you.
Yeah, nobody will receive the HICPICs until December.
Okay, so at least get your CPT books and bring those. Darcy, takeaway for tonight. And yes, we're ending a little early. I expect you to go home and take the extra half hour and do your homework. Darcy, takeaway.
We went over a lot, so I don't really have anything specific.
Okay. Maria.
Well, I had to ask you to repeat some of these. When you give us the answers, can you say it first and then repeat it so I don't have to ask you to repeat it?
Yes.
Okay?
Yep.
Thank you.
Fran.
Yeah, there's just a lot more to cover, but now we're actually getting into the more detailed stuff, it seems now, so that's good. Yep.
Okay. Anita.
Your day passed by is, I'm really comfortable.
Good. Daniel. Yes. Focus. Focus. And Shana.
I still have questions about highlighting this.
Okay. All right, everyone. Have a great week. See you
You
next
too.
week.
Okay,
Thank you very
too.
much.
Thank you.
Thank you.